Welcome to the Deep Dive, where we take complex topics and really try to distill them into essential, actionable knowledge. Today, we're tackling a subject that impacts millions of Americans every single year, especially, as we get older: heart failure. What if your body is sending you critical warning signals right now? Signals that could genuinely save your life, but maybe you're dismissing them, just thinking, oh, I'm just getting older or I'm out of shape. Every year, over 6 million Americans live with heart failure, and research shows that most people, particularly those in the 65-plus age group, they tend to brush off those early symptoms. But what they might not realize is that their heart is, desperately trying to communicate something vital.
That's such a crucial point. Because heart failure doesn't mean your heart is stopped. Not at all. It just means it isn't pumping blood efficiently enough to meet your body's needs. Oxygen, nutrients, Yeah. And yes, it's a serious chronic condition, but early detection is absolutely key. When you catch it early, it's often very manageable. Timely intervention can drastically improve outcomes, quality of life too.
Right. So our mission today is to really unpack these often overlooked early signs of heart failure. Some of these might truly surprise you, like a simple symptom that happens when you just bend over to tie your shoes, or maybe why you suddenly need a stack of pillows just to sleep comfortably. By the end of this deep dive, you'll know exactly what to watch for and, importantly, when to think about seeking medical attention. Okay, here's where it gets really interesting. Let's maybe start with what your lungs might be telling you. The first big category of warning signals seems to relate to breathing. Think about shortness of breath during activity. Doctors call it exertional dyspnea.
Exertional dyspnea.
This isn't just about being winded after, say, an intense workout. We're talking about feeling breathless, climbing maybe just one flight of stairs, or walking to your mailbox, things that used to be easy.
That's a really powerful distinction. And it happens simply because your heart isn't pumping efficiently enough.
Yeah.
It can't meet your muscles' oxygen demands during that activity. So when it can't keep up, your breathing gets labored. Your lungs are basically working overtime trying to compensate. The American Heart Association, they note this is one of the earliest and most common symptoms.
Especially if people get older.
Okay, so it's not just being winded, it's the change, the progression. It sounds like people might just recalibrate what feels normal for them.
Right.
What would you say is the biggest mistake people make when they start noticing this kind of change? Particularly, say, someone over 65. Exactly right. The key insight isn't just being winded. It's the story of decline, the progression you mentioned. If you find yourself subtly adapting, maybe taking the elevator instead of the stairs you always took, or needing longer to catch your breath after bringing in the groceries, that new normal is actually a critical whisper from your heart, and it's often ignored. Medical studies show this often appears months, sometimes even longer, before other, more obvious signs pop up. And the biggest mistake, just dismissing it, saying, oh, I'm just out of shape, or crucially, this is just part of getting older. For the 65-plus group, that's a really common and dangerous assumption.
Okay, so shifting from daytime exertion to what happens when you try to rest. There's this other subtle symptom. It can creep up so gradually you might not even notice it's abnormal. It's called orthopnea. Needing more and more pillows to breathe comfortably while sleeping. You might start with one extra pillow, then maybe two. Eventually maybe even sleeping in a recliner just to breathe okay.
It's fascinating, isn't it? Because so many people just rationalize it. Oh, I'm more comfortable this way, or I just prefer sleeping propped up. But the real insight here is that your body isn't just seeking comfort. It's actively trying to compensate for fluid that's backing up when you lie flat.
How does lying flat cause that?
Well, when you lie down, gravity isn't helping your heart anymore to pull blood back from your legs and lower body. So if your heart is weakened, that blood can sort of pool or back up in the pulmonary veins, the ones leading from your lungs. This causes fluid to leak into the lung tissue itself, making it physically harder to breathe. Research from top cardiology centers shows orthopnea is present in roughly 80% of patients with heart failure. It's a really significant sign, often dismissed.
Wow, 80%. And building on that, there's something even more, terrifying sounding: paroxysmal nocturnal dyspnea, or PND. This is waking up suddenly, gasping for air, maybe feeling like you're drowning, heart racing, needing to sit bolt upright or even stand up to catch your breath. That sounds awful. Now, if someone already has, say, sleep apnea, how can they tell if it's just their sleep apnea getting worse or if it's this PND thing?
That's a really good question, because there can be overlap and it can be confusing. PND typically happens maybe 2 to 4 hours after you fall asleep. The key difference is often that feeling of acute, sudden breathlessness. It often only gets better when you sit fully up or even stand up. See, with PND, When you lie down for a while, that fluid that might have collected in your legs during the day gets redistributed back into your general circulation, including towards your lungs. If your heart's already compromised, it just can't handle that sudden increase in fluid volume. That's what causes that sharp shortness of breath that jolts you awake. People often blame it on nightmares or anxiety or, maybe worsening sleep apnea. But that specific pattern, waking up gasping, needing to sit or stand for relief, that really warrants an immediate medical checkup.
Okay, that's clear. There's also a cough, right? A persistent, nagging, dry cough that only seems to show up at night or when you're lying down. It disrupts sleep, maybe gets better if you sit up. It's not like a cold or allergy cough.
Exactly. It's similar to orthopnea in its cause.
Yeah.
That fluid redistribution when you lie flat can cause some mild fluid buildup in the lungs. Your body senses this, perceives it almost like an obstruction, and tries to clear it by coughing. Medical literature often describes it as being worse in the early morning hours. Sometimes it might come with a slight wheeze, or maybe even a little bit of white or pink-tinged frothy mucus.
Frothy mucus.
Yeah, that's a pretty specific sign of fluid actually in the lungs, pulmonary edema. But again, it's so easy to just blame this cough on allergies, or maybe post-nasal drip, especially if it's dry. But if it's persistent and linked to lying down, it shouldn't be overlooked.
Right. Okay, so moving beyond the lungs. The body often sends very visible signals through fluid buildup. We've all had those days where our socks leave a mark, But what you're describing is when those indentations become much deeper or they stay there for a long time after you take your socks off. Let's talk about ankle or leg swelling peripheral edema. You said this is one of the most visible early signs, and it gets worse through the day.
That's right. It's very common. When your heart can't pump effectively, blood flow slows down, and it tends to pool in the lower extremities because of gravity. On top of that, your kidneys aren't getting as much blood flow as they should, so they react by holding onto sodium and water.
Okay.
This extra fluid then gets forced out of the blood vessels into the surrounding tissues, causing the swelling. It's present in something like 70% of heart failure patients at diagnosis, and typically its symmetrical affects both legs about the same. And that key thing you mentioned, if you press on the swollen area with your thumb for a few seconds, and it leaves an indentation that stays there after you lift your finger, that's what doctors call pitting edema. That's a definite warning sign.
Pitting edema. Got it. And perhaps the most measurable early warning sign is rapid weight gain from this fluid retention. You mentioned potentially 2 to 3 pounds in a single day, or maybe 5 pounds or more in a week. That seems like a huge jump.
It is, and it's a critical indicator. It's not fat gain, it's fluid. A failing heart triggers these hormonal responses, telling the kidneys, hold on to salt, hold on to water. And basically, each kilogram, about 2.2 pounds of weight gain, represents roughly 1 liter of excess fluid trapped in your body.
Wow, 1 liter per kilogram.
Yeah. So medical guidelines, like from the American Heart Association, are very clear. That kind of rapid weight gain warrants an urgent call to your doctor or healthcare provider. And importantly, this weight gain often happens before other symptoms, like significant shortness of breath or visible swelling, become really obvious. So for our listeners, especially those 65 and over, getting into the habit of daily weighing can be a really powerful early warning system. It can actually help prevent hospitalizations.
That's a really practical tip, daily weighing.
Okay.
Another often puzzling symptom is nocturia, frequent nighttime urination, suddenly needing to get up to pee way more at night than you do during the day.
And again, this is one that's so easily attributed to other things. Oh, I'm just getting older, or I drank too much water before bed. But it absolutely can be an early sign of heart failure, and it's often overlooked.
So what's the heart connection there?
Well, think about it. During the day, when you're upright, gravity pulls some of that excess fluid down into your legs and lower body. Then when you lie down at night to sleep, gravity helps that pooled fluid redistribute back into your bloodstream. Your kidneys suddenly get this bigger volume of fluid coming through them, and they respond by working overtime to filter it out.
So the fluid that was pooling during the day gets processed at night.
Exactly. Research shows this can be one of the very earliest signs, sometimes showing up before the shortness of breath or the obvious swelling. Patients might report waking up, 3, 4, even more times a night, and often producing larger amounts of urine than usual.
Interesting. Okay, before we move off the fluid story completely, let's touch on some less obvious signs, but still related, that show up in the digestive system. Things like persistent abdominal bloating, maybe losing your appetite, or feeling full really quickly, even after eating just small amounts. These seem totally unrelated to the heart.
They absolutely seem unrelated, which is why they're so often missed. But they are connected. Heart failure impacts your entire circulation, right? including the blood flow to your digestive organs. So reduced blood flow there, combined with potential fluid accumulation in the abdomen itself called ascites and maybe some congestion in the liver. All of that impairs normal digestive function.
Okay, so the gut isn't getting what it needs.
Pretty much. These symptoms like bloating or early fullness feel generic, maybe like indigestion. But patients might report this persistent nausea or just a feeling of pressure in their belly that makes eating uncomfortable or difficult. It's really quite fascinating how far-reaching the effects of a struggling heart can be, even impacting your digestion.
Yeah, it really underscores how interconnected everything is. Okay, let's shift gears a bit now to some more subtle shifts. Things related to energy levels and circulation that could be warning signs. First up, overwhelming fatigue and reduced exercise tolerance. This isn't just feeling tired like you need a good night's sleep. It's described as persistent exhaustion. Even if you are getting enough sleep, it just feels different.
It does feel different. It's profound. What's happening is your heart is failing to pump efficiently, right?
Yeah.
So your body, quite intelligently actually, starts diverting blood flow. It sends blood away from less critical areas like your muscles and prioritizes vital organs like the heart itself and the brain.
Makes sense. Survival mode.
Exactly. But the consequence is that your muscles receive less oxygen-rich blood. And that leads to this deep fatigue and weakness. This symptom can creep in months before other, more obvious signs appear. You might notice your recovery time after any physical activity gets dramatically longer. And the progression is often so gradual that people just adapt their lifestyle without really thinking about it. They blame age. But as we've said, this progressive decline in stamina, it isn't normal aging. Especially for those over 65 who might already expect some increase in fatigue, making this symptom particularly easy to miss or misattribute.
Right. Another one is feeling lightheaded, dizzy, or even having near fainting episodes. We often chalk these up to, maybe standing up too fast or being a bit dehydrated. But how do we know if it's potentially something more serious?
Well, the underlying issue here is that your weakened heart just can't pump enough blood consistently to maintain adequate circulation to your brain. This is especially true during changes in position, like standing up or during exertion. Your body can't make the usual rapid adjustments to maintain blood pressure. Clinical studies suggest that syncope, actual fainting, occurs in about 20% of heart failure patients. And it can be an early warning sign.
20%. Wow.
Yeah. So while these episodes can certainly be triggered by dehydration or maybe medication side effects if they happen alongside other symptoms we're discussing, or maybe seem to occur without a clear external cause, it suggests a potentially serious decrease in cardiac output, the amount of blood your heart pumps, and that definitely warrants investigation.
Okay. You might also notice persistently cold hands and feet, right? Even when it's warm. Maybe even a sort of bluish tinge to fingernails or lips. This seems to speak again to how the body is prioritizing blood flow.
Precisely. It's that same diversion strategy. The body sends the limited oxygenated blood to the vital core organs, brain, heart, and reduces circulation to the extremities, the hands and feet. This leads to them feeling persistently cold. That bluish tinge, called cyanosis, indicates lower oxygen levels in the blood reaching those areas. A related but maybe more subtle sign that doctors often look for is something called a narrow pulse pressure.
Narrow pulse pressure, what's that?
It's the difference between your top blood pressure number, the systolic, and the bottom number, the diastolic. Normally that difference is maybe 40 points or more. If it's consistently less than 40, say your pressure is 110 over 80, the difference is only 30. That narrow gap can indicate your heart isn't pumping out a strong enough volume of blood with each beat. It's another one of these circulatory clues pointing towards decreased cardiac output.
Interesting. Okay. Another sign that can be really unsettling for people is feeling your heart flutter or pound or skip beats, even when you're just resting.
Yes, palpitations or sensing an irregular pulse. This happens because as the heart muscle weakens, it struggles and works harder. This strain can lead to the development of irregular heart rhythms or arrhythmias. Something like atrial fibrillation or AFib can actually be both a cause of heart failure and a consequence of it. It can create this kind of vicious cycle that makes things worsen more quickly.
A vicious cycle.
These palpitations are often more noticeable when you're resting, maybe lying down, and they can sometimes be accompanied by anxiety, understandably. But if they're happening alongside these other symptoms, they definitely need medical evaluation.
Okay. And finally, I have to admit, I hadn't really heard of this one before we started looking into this material. But Bendopnea, it sounds so specific. This is shortness of breath that comes on within about 30 seconds of bending forward, like tying your shoes or picking something up or leaning over a sink. Can you explain what makes that specific action trigger breathlessness in heart failure? What's going on there?
You're right, it is remarkably specific and often surprises people. It was only really formally characterized in the medical literature back in 2014. So what happens is this. When you bend forward at the waist, you increase the pressure inside your abdomen.
Okay.
That pressure pushes up against your diaphragm, the big muscle under your lungs. And this, in turn, temporarily increases the pressure inside your chest cavity. Now, if your heart is already struggling with what we call elevated filling pressures, meaning it's already having a hard time handling the volume of blood returning to it, that extra squeeze, that sudden increase in chest pressure from bending over, is enough to quickly trigger breathlessness.
It's like the final straw for an already struggling system.
Exactly. Studies have found bendopnea is present in approximately 30% of patients with advanced heart failure. And importantly, it's strongly associated with more advanced disease and, unfortunately, increased mortality risk. Healthy individuals very rarely experience this. So if you notice it, it's a very strong signal that something significant is going on with your heart's ability to handle pressure and volume changes.
Wow. Okay, so bringing this all together, what does this mean for you, our listener? We've really dug into over a dozen signs here, many quite subtle, that your heart might be struggling. From that exertion that leaves you breathless to maybe nights interrupted by a cough or that surprising discomfort when just bending over. If you've recognized yourself, or maybe a loved one, in some of these descriptions, the message isn't to panic, but absolutely, please do not ignore them.
That really is the critical message. These symptoms often develop so gradually and they're so easy to dismiss, especially as we've emphasized as we get older, we just chalk it up to aging. But when several of these symptoms start appearing together or when activities that used to be easy become unexpectedly difficult, your heart might genuinely be telling you something critical. Now, while gentle monitoring is fine for very subtle changes, certain symptoms do need immediate attention. Things like severe shortness of breath, any chest pain, sudden confusion, very rapid swelling, or that swift, unexplained weight gain, especially if symptoms are getting worse even when you're resting. Right. And remember, heart failure doesn't mean your heart has stopped working. It just means it's not pumping as well as it should. And modern medicine offers incredible tools and strategies to manage it effectively, especially when caught early.
Yeah, the diagnostic tools have become quite sophisticated, haven't they? Doctors can use an echocardiogram, that's an ultrasound of the heart, to look at the heart chambers, their size, and importantly, measure the ejection fraction. That's how much blood your main pumping chamber, the left ventricle, pushes out with each beat. There are also blood tests. They can measure levels of something called B-type natriuretic peptide, or BNP. Those levels are often elevated in heart failure. And then there are things like a chest x-ray, which can show fluid in the lungs or maybe an enlarged heart, and an electrocardiogram, the ECG or EKG, to check for any irregular heart rhythms.
And what's really fascinating now is how cutting-edge research is using electronic health records, EHRs. Studies are showing that analyzing the unstructured data, like the notes doctors write, not just the lab values, can be incredibly powerful. Details related to symptoms, like the ones used in the classic Framingham Heart Study criteria, that landmark study that taught us so much about heart disease risk when pulled from notes, can sometimes predict heart failure years before a formal diagnosis is made.
Wow, years before?
Potentially, yes.
Yeah.
It points to this amazing potential of combining the hard data, like lab results, with the richer, sometimes more subtle observations captured in clinical notes. This could be especially helpful for identifying risk earlier in that 65-plus age group.
That's incredible. And when it comes to treatment and management, you said it's often manageable, especially if caught early. While heart failure often can't be completely cured in most forms, there are effective treatments that can control symptoms, often for many years, right?
Absolutely.
Yeah.
Medications are a cornerstone. There are drugs to help strengthen the heart's pumping action. There are water pills, diuretics, to help your body get rid of that excess fluid. And there are newer classes of drugs too, like SGLT2 inhibitors. These were actually first developed for diabetes.
Right, I've heard about those.
Yeah, but they've shown such profound benefits for heart failure, even in people without diabetes, that some experts are calling them the statins of heart failure prevention. It's quite remarkable.
Statins of heart failure, wow.
Beyond medications, though, lifestyle modifications are absolutely essential. They can significantly slow down and sometimes even help reverse disease progression. We're talking about things like adopting a low-sodium diet, really important for fluid management, regular, appropriate physical activity, managing weight, definitely avoiding tobacco, limiting alcohol, and managing stress. Your healthcare team will likely also recommend daily monitoring at home. tracking key things like your weight, specifically looking for those rapid gains, maybe blood pressure, heart rate, and possibly even keeping an eye on your fluid intake. And one last important point. Symptoms can vary. We touched on this, but it bears repeating, especially concerning older adults. For instance, women sometimes report subtler, maybe more vague symptoms like fatigue, nausea, or indigestion, while men might more often experience the classic chest pain or very noticeable swelling, the edema. Recognizing these potential differences is really important for ensuring everyone gets diagnosed and treated early.
That's a really key takeaway. Okay, so what does this all mean for you listening? We've covered a lot ground here, delving into, over a dozen subtle yet significant signs that your heart might be struggling. From that breathlessness on exertion to the nighttime cough, maybe swelling, fatigue, and even that peculiar bendopnea.
The takeaway here, I think, is a really powerful one. The future of heart health is shifting more and more towards proactive, personalized prevention. With the rise of advanced tools like AI and machine learning analyzing huge data sets like electronic health records, we're getting better at identifying individuals who might be at risk of heart failure years before they even have obvious symptoms. It means your personal health data holds this incredible, still largely untapped potential for early intervention.
Exactly, and that really leads to an important question for you, our listener. Armed with this deeper understanding of heart failure's subtle whispers, what steps can you take now? How can you become an even more informed and proactive partner in your own health journey? What conversations might you initiate with your doctor or healthcare provider at your next visit? Really staying attuned to your body's messages, understanding what they might mean, and acting on them. That can truly make a dramatic difference in your quality of life and your longevity.